Hi, my name is Raquel Pasarón, and I am the nurse practitioner for the colorectal program at Nicklaus Children's Hospital. I will be demonstrating today how to perform retention enemas. A retention enema is part of a bowel management program aimed to help your child maintain his bowels clean for a 24-hour period of time. The liquid in the enema is very safe, and it's given through a tube that is inserted into the rectum. This procedure takes approximately 1 hour of your day daily. Things to remember about the retention enema program. 1 is sit with your child and explain to them the procedure. If you have other children, they will need to understand why this is being done and why this is private for the child. Retention enemas have been in place for over 20 years, and they have no negative long-term effects. It will take 15 minutes to give the enema. It will take 15 minutes for the solution to stay in the colon, and then it may take up to 45 minutes for your child to sit on the toilet to empty out the solution. I'm going to go over the supplies that you will need to perform the retention enemas. Please remember that your healthcare provider will provide prescriptions for all of these supplies. You will need non-sterile exam gloves. You're going to need a 22 or 24 French Foley catheter. I'm going to be showing you specifics about this Foley catheter, but this Foley catheter has a very large balloon. You're going to be using water-soluble lubricant, normal saline. You may also use water if your healthcare provider wants water instead of saline. You will need a gravity feeding set, and I will go over the specifics of this in a couple of minutes. You will need what's called a Luer Lock 20 ml or 20 cc syringe to inflate the Foley balloon. And you may need a catheter tip syringe. You will also need an IV pole or a hanger or hook. Additionally, your healthcare provider may prescribe certain medications to add to the normal saline or water. These may include Castile soap, glycerin oil, or mineral oil, to name a few. Now we're going to get our supplies all together. The first thing you'll do is wash your hands with mild soap. Then you will don your non-sterile exam gloves. We're now going to test the balloon on the Foley catheter. The port that you will use is the one with letters and numbers. Again, you want to make sure that you have a 24 or 22 Foley catheter based on the prescription that you were given. Then you will use your 20 ml Luer Lock syringe. As I said earlier, this is a 30 ml balloon Foley catheter. So we're going to instill 30 mLs of air into the balloon port. You will draw back the plunger to 20 mLs, and you're going to connect it to the balloon port. Make sure that you lock it tightly in place like so. You will then instill the air into the balloon port. When you do this, you want to maintain your thumb on the plunger. We have now instilled 20 mLs, but please remember this is a 30 ml balloon. You will disconnect the Luer Lock syringe maintaining your thumb on the plunger and turning the syringe counterclockwise. You're going to pull back 10 mLs of air on your syringe and repeat what we just did, which is connect your luer lock syringe to the balloon port, nice and tight, and instill an additional 10 mLs of air. You will now again disconnect the luer lock syringe. You'll make sure that the balloon is nice and intact. We will now then withdraw the air, and if you notice, the balloon will collapse. You want it completely collapsed, and so you want to withdraw all of the air that you just instilled. That maneuver was simply to check the balloon on the Foley catheter. We will now lubricate the tip of the Foley catheter and have it ready. Now we're going to hang your gravity feeding set onto your IV pole or your hanger or hook. You want to close the top and hang it. You will notice that the bag has measurements on the side. This tells you how much to instill with the fluid that your prescriber gave you. On the one end, you have the connection port, and here you have a clamp. The clamp is to either close or open. To close, you pull the roller clamp down. To open, you pull the roller clamp up. We're going to close it right now, so we're going to pull the roller clamp down. We're now going to instill the liquid, we're using normal saline for this child, into the bag. We will use 500 mLs for this procedure today. You're going to grab the bag. You're going to open the top, and you're going to fill it to the 500 ml mark. Just checking. And here we go. We're going to close the bag up again and hang it. Okay. Now we have to prime the tubing of this fluid. It's important to have a garbage can or a receptacle where you can have the fluid go into. In order to do that, you're going to need to open up the roller clamp. Again, the roller clamp is opened up by going up, and then you remove the top from the cap. Once your fluid is primed, you're going to close the roller clamp and put your cap back on. You are ready to go. Now we're ready to start the retention enemas. This is one of the parts that most parents are very anxious about. Most parents are not nurses, are not doctors, are not healthcare providers, but this is your child, and you're going to do a really good job. We want to give the child as many choices as possible. Please remember that you're here because the child wants this, and it's going to make a huge difference and a huge impact on their lives. They will no longer be soiling or staining, and possibly the goal will be no longer using diapers or pull-ups. That's a great goal. You want to give the child the option of which position to do the retention enema in. I usually prefer the child laying on their tummy, but the child may not like that position. They can lay on their side, and some parents even do it with the child laying on their backs. You need to discuss with the child what is best for both of you. The other thing that you want to do is provide some distraction during the procedure. They can use books, they can watch TV, they can use their personal tablet. I've even had children play their manual pianos while we're doing the retention enemas. You get to choose that between you and your child. The most important thing is that they're comfortable, that you're comfortable, and that you know that this is going to work, because it will. We're going to go ahead and start by inserting the Foley catheter into the rectum. You have everything prepared, so we're ready to go. I would recommend that you insert the catheter about 6 inches in. You're going to have the tip nicely lubricated. Insert. It should go nice and easy, and you leave it in. Now you're ready to inflate the balloon. Remember that you've already checked it. Again, you're going to use a luer lock syringe and insert it into the balloon port. And you're going to insert 30 mLs of air. We're going to draw back 20 mLs, insert the luer lock syringe nice and tight, and start inflating the balloon. As you inflate the balloon, you want to withdraw until you meet some resistance, and you continue inflating the balloon. Please remember to continue placing your thumb on the plunger to keep the air in. You unscrew the syringe, and you're going to insert an additional 10 mLs or cc of air into the balloon port. Now you've instilled 30 mLs or cc's of air into the Foley. Now you're ready to attach the gravity feeding set onto the open Foley catheter port. You're going to remove the cap, set it aside, and put the gravity feeding set port into the Foley catheter. And now you're going to open the gravity feeding set by pulling the roller clamp up. Again, remember, up opens, down closes. As you do so, you want to look at the chamber and make sure that everything is going in nicely, drop by drop. You're going to open up the roller clamp, and while you're doing that, you want to look at the drip chamber to make sure that the fluid is flowing. You don't want it too fast, and you don't want it too slow. The fluid amount should go in about 15 minutes. If you're using an IV pole, the higher the pole, the faster the fluid will go in. The lower the pole, the slower the fluid will go in. You want to, again, gauge 15 minutes of installation time. During this time, you want to make sure that the child is tolerating this. If there's cramping, you want to slow down the drip. If not, you just let it empty out until you're done with the solution. Again, remember that the retention enema should go in about 10 to 15 minutes. So now we're done with the enema. You'll notice that the enema bag is empty. Now what we'll need to do is give the child 15 to 20 minutes for the solution to stay in. You can keep the enema bag connected or disconnect the enema bag to provide a little bit more freedom. I like to disconnect the enema bag. You want to make sure that the roller clamp is completely closed, and you want to have something in order to keep the solution in. What I like to use is the end of a catheter tip syringe, and I put the syringe to the side. I pinch the catheter so the solution doesn't come out, and I remove the port from the feeding bag and put the cap of the syringe inside. This can just be kept like that for the next 15 to 20 minutes to allow the solution to stay in. Now that 15 to 20 minutes have passed, you're ready to get the child onto the toilet. You will move the child with the catheter in place. You can do this a couple of ways. I recommend that you put on a diaper or their underwear so they can walk to the bathroom and sit on the toilet with their underwear on. So in case that there's any leakage that occurs, the underwear catches it. Or you can simply put some towels on the floor and walk towards the bathroom. Either way, you want to have the bathroom very close to where you're doing the retention enema. Once you get to the toilet, you're going to have the child sit on the toilet and then remove the catheter. In order to remove the catheter, you're going to need the 20 ml Luer lock syringe. So let's do that now. Sitting on the toilet, you're going to get the end where the balloon port is and connect your 20 ml Luer lock syringe. Again, you're going to screw it on and pull back on the plunger. Please remember, we instilled 30 mLs of air, so we need to withdraw 30 mLs of air. That's our first 20. And now we're going to connect it again and withdraw the remaining amount of air. Once you've done that, you can remove the syringe and pull the catheter out. None of this should hurt. The only thing the child should feel is some pressure. Now you'll allow the child to sit on the toilet for the next 15, 30, or 45 minutes to have a bowel movement. Remember that the goal of the retention enema program is to keep your child clean for a whole 24-hour period. During the next 24 hours, you will take note of how many times they go to the bathroom to have a bowel movement. The goal is only one time within the first hour of the retention enema. However, if they have more bowel movements after that hour, please document them to provide to your healthcare provider. This information will help us help you with the retention enema recipe. Please remember that the recipe may change daily based on this information that you provide to us. We will come to a recipe that is appropriate for your child, again, with the goal being to keep him or her clean for a 24-hour period without soiling or staining. We will walk together with you through this journey to ensure that your child is kept clean. It has been a pleasure for me to be with you during this video. We hope that you have found this information helpful. If you have any further questions, please feel free to call us at the Colorectal Center at Nicklaus Children's Hospital.